Solantes. Okay, open. Feel.
Speech-language pathologist Carla Cuadro is helping this man swallow and produce his voice again. He had a stroke after catching COVID-19 infection last year. The health department says less than 1% of COVID-19 patients in the country had a stroke. But they're not the only ones who need therapy after recovery. Cuadro says swallowing disorder is the most common problem among COVID-19 survivors, especially those who needed a ventilator while sick. Having a tube connected to the nose or mouth for a long period could result in swallowing or speaking disorders.
May mga iba, severe cases, because of prolonged proning or nakadapa po sa ICU, nabulag na po. So grossly impaired cognition and awareness, very deconditioned na po yung muscles.
But even those who didn't need a ventilator and only had mild or moderate COVID infection could also have speech disorders like slurring or stuttering. Glenda Lactao is having brain fog like slowed thinking, word recall issues, forgetfulness, and problems in coordination after recovering from mild COVID-19 infection last May. She also often runs out of breath when speaking, issues she didn't have before getting COVID-19 infection.
May times po na nabubulol o iba yung nasasabi, nalilito pagka may ginagawa po, tapos nagsasalita, ang bilis po hingalin.
Because of the inflammation during the acute infection, it causes also what we call brain fog.
Some people complain of forgetfulness. Some people report an inability to sustain their attention to a person talking or sustain their attention to what they are doing or even paying attention to their surroundings.
Glenda wants to get rid of her long COVID-19 symptoms. She needs to be 100% alert on her job as a caregiver. But experts are still unsure how long this will last. Infectious diseases expert Dr. Solantes says rehabilitation is important.
Give me a big haw.
For one, speech pathologists can help COVID-19 survivors get better through therapy.
Halimbawa, those who experience brain fog. What if they're unable to function at work? How does one resolve slowed thinking, slowed processing, slowed communicating? So an astute SLP can help a person via cognitive communication therapy para gradually i-reintegrate ang tao back to work habang nag-i-improve siya.
Experts also suggest having post-COVID clinics in the country to monitor and help those who are still having health problems after recovering from COVID-19 infection. Caroline Bongkin, CNN Philippines.